and politicians in New York State have issued a gag order on medical workers and police. They're no longer able to confirm or deny any coronavirus cases. Gail Bernstein of New York State, the Erie County Health Commissioner, has told police and fire departments they are not allowed to alert the public of suspected or confirmed cases. Gail Bernstein had the Tonawanda Fire Department delete a Facebook post alerting the public that there was coronavirus cases. The North Tonawanda Fire Department took a patient to DeGraaf Memorial Hospital where they were confirmed to have coronavirus. However, New York State is not letting this information get out. They have put a gag order on our brave police and firemen. Even though our firemen and police are not allowed to discuss this with the public, I had one police officer from Tonawanda contact me personally and let me know that a gag order has been placed and a confirmed case has been issued in North Tonawanda. Cases are popping up all over New York State, but because there's a gag order on healthcare workers and the police and fire department, we're not being letting known the truth. This is the same as China and it makes no sense. It's time for our leaders to stop placing gag orders on the civil servants and let them do their jobs and protect the health and safety of the public. As a spouse of a healthcare worker in New York State, I'm concerned if Buffalo has over 6 cases of coronavirus. How many does New York State have in total? Now it's Watertown, Rochester, and Buffalo where cases that I know have been confirmed and suspected. How many true cases are in New York City? A city hundreds of times bigger than Buffalo. I don't believe that New York City has no cases and they only have a handful of unconfirmed cases. This doesn't make any sense.
Again, I think this may be why.
They may be trying to avoid medical martial law. If the county health department activates the health emergency declaration, it's like martial law. The declaration contact tracing authorizes the use of force in the event that officials encounter resistance while taking temperatures, detaining and transporting competent individuals to a military facility authorized for quarantine. If or when this happens, large cities with populations in the millions could go out of control fast, like China. Maybe they're just trying to give people a chance to prepare in case this happens. I agree that people need to know.
This is the military website for planning for the novel coronavirus. And it goes down here. It has all the stuff they're doing to prepare for it. Let's see. If it'll narrate for me. I don't know if it will.
The current threat of the 2019 novel coronavirus has raised concern that this virus could result in a pandemic disease. In such a scenario, nCoV could spread, infecting U.S. personnel, and threaten the operational readiness of the U.S. Marine Corps. The Marine Corps' response to a pandemic outbreak focuses on 5 major areas. 1. Force health protection, FHP. 2. Disease containment planning, DCP, and readiness. 3. Continuity of operations, COOP. 4. Defense support of civilian authorities. An outbreak of a new, novel, coronavirus is rapidly evolving, but currently poses a low risk to personnel located in CONUS. The 2019 nCoV is a viral respiratory disease related to Middle East Respiratory Syndrome, MERS-CoV, and Severe Acute Respiratory Syndrome, SARS. Symptoms of 2019 nCoV may include fever, cough, and shortness of breath.
And here's the World Health Organization website on operational planning guidelines for the support of the country's preparedness and response to the coronavirus. see the World Health Organization. And I'll put this link in the description box below because it's a pretty long read. But here's, the introduction to the table of contents. It's got the monitoring, community, surveillance, case investigations, and stuff like that. It's a long, very long PDF.
Government preparedness is happening on a local, state and national level as the outbreak is expected to escalate in the coming days. On Friday, February 14, 2020, San Diego County has activated contact tracing. U.S. Northern Command said the two State Department chartered evacuation flights carried around 300 passengers bound for military bases in Southern California and Nebraska, where they will be quarantined for 14 days. One of the flights will land at Travis Air Force Base in California for refueling before continuing to Omaha. The other will go to Marine Corps Air Station Miramar in San Diego, Northern Command said. The quarantines will be managed by the Centers for Disease Control and Prevention.